first, let's understand what a medical record is or what a patient's chart. So every time you guys hear the term medical record, chart, or note, we're talking about one common thing, okay? We're talking about the patient's counter record. And counter record means what has been documented, okay, when a patient completed a visit with the doctor. So that's what a medical record is. A medical record, guys, there are different parts where you need to understand as a medical coder, where you need to understand what are those parts of the medical record that you can extract information in order for you to be able to translate those medical terms into a code. Okay, so let's begin with what do you expect when you look at the medical record? So, of course, you expect the patient information, right? Starts with we call it MRN or medical record number. So that's the header. Most of medical records start with that. Now you have the MRN, you have the patient's date of birth, okay? You have the patient's name. Or sometimes patient's name, right, is patient's name first and then the patient's date of birth. But different charts, different ways of scribes or clinicians do their patient information or how they document them. Now, so you have this patient information on top, and then right after patient information, you have what we call here the date of service. Okay, you know what? So it looks very consistent. What I'm going to do is I will put the medical or the patient's name after the MRN right here. Okay, patient name, and you have the date of birth. Okay, DOB's date of birth, and this one is the date of service. Sometimes medical record would call it date of encounter, okay, or date of visit. So there are ways that people document this. Sometimes date of service, date of encounter, or date of visit. So they all mean the same, okay? Depending on, like I said, the electronic medical or EMR. That when I say EMR, guys, this is the portal that physicians or anyone who is involved in a patient's documentation use in order to document everything that has happened during that encounter. So EMR, there are many types or many kinds of EMR or electronic medical record that facility use depending on they're comfortable with. Okay, so this is the patient information, and then after that you have all the patient information. Now, it starts with the history. Okay? So, history, guys, okay, there are many components of the patient's history. When we talk about patient's history, it talks about is the patient's currently having at the moment, why the patient is in the doctor's clinic right now. So we call that as history of present illness, okay? History of present illness. Okay, so we call it sometimes HPI, okay? HPI or history of present illness is part of the patient's history. Now, the HPI or an illness tells you everything about the background or the reason why patient is in the clinic at the moment. Let's say, for example, patient suffered a fall. Okay, suffered a fall. Patient resides in a nursing facility or a memory care facility and suffered a fall, and patient was seen by the attending nurse, and then was able to call 911, and then patient was brought to the emergency department. So the HPI here tells you all these stories, like patient fell, patient was, having weakness, patient, suffered a minor trip and fall, and because of that, patient suffered a minor fracture. Now, patient is now in the clinic because of fracture, which obviously is very painful for the patient. That's your HPI. Okay, and also HPI, a complete HPI, I would say a good HPI or history of present illness also tells the current user of the chart what are the past medical history of the patient, meaning that in the HPI itself, it will tell you patient whether patient is diabetic, whether patient has a cognitive impairment, like if patient has dementia, if patient is also hypertensive, having a difficulty in breathing. Everything is reported in an HPI. So a good HPI, just guys, just looking at a good HPI, you will already understand what kind of a patient you are dealing with at the moment. Okay, if you are the doctor, you are the clinician, you already know what may be a good working diagnosis that you may come up at the end of the visit because of the patient's comprehensive history of present illness. Okay, so it basically tells you the whole story of why patient is in the clinic right at this moment. Okay? Now, so you have the history of present illness. You also will see in the history patient's active problem list or active problems, right? So just like what I have mentioned earlier, you have the history of present illness, you have the past medical history. Now you also will see patient's active problem list. Like if a patient is in like a paralysis, patient does have a weakness of half of the body, patient is paraplegic. So is that an active problem? Patient is diabetic. So you will see this. Part of the history is patient's active problem list. What are the pressing problem that a patient is suffering currently, okay, or patient is suffering at the moment? So that is the active problem list. Sometimes active problem list and the past medical history, they, I would say, doctors interchangeably use this active problem list and past medical history as they treat them the same. But there are no perfect past medical history or perfect active problem list. They need to be updated from time to time. What is important is the patient's history also consists of this active problem list. Okay. Now, aside from that, okay, what else is part of the patient's history? It also contains patient list. Okay, so medication list. It's part of patient's history. So what are those? If a patient is on antihypertensive medication, it's there. Okay. If a patient is currently taking insulin because patient's diabetic, it is in the medication list. If a patient is currently taking like an anticoagulant, like Eliquis or aspirin or warfarin, anything that a patient takes, okay, on a daily basis or probably on a per need basis, it's on the medication list. If a patient is asthmatic, taking inhaler, it is on the medication list. It is part of the history. Okay. And I think lastly would be the part of the history would be the patient's social and family history. Okay. Social and family history. So what are these? What are these two histories information here? Social history would be the part of the chart, guys, of patient's record where the patient would indicate whether patient is an active smoker. Okay, if a patient does alcohol, okay, occasionally, or patient is chronic alcohol use pattern, then it's on the social history. What else? Patient's vocation, patient's occupation. Patient is a professional. If a patient is, works in a factory, a patient is a public service type of employee. So everything here is in social history. Now, social history may not be complete, guys. Now, the important reason why social history is significant in in the patient's record is that because sometimes the doctor will get information from the social history, what could be the reason why patient is having this type of disorder. Like, for example, if a patient works in, as a public servant, as a public service type of job that he does or she does, maybe the patient, is suffering from stress from work, something like that. Or if a patient works in a factory, exposed into that type of work or type of chemicals or whatever a patient is, being exposed to, it is in the social history. Okay, if a patient is currently is a current smoker or passive smoker, probably patient's asthma or COPD has something to do with patient's smoking history. So that's your social history here. There's a lot of information that can be taken also from this part of the patient's chart. Now, the family history obviously is, any information or health information about the patient's family, right? And I'm pretty sure it's not new to you that when you go to the doctor, the the nurse or whoever the medical assistant who is taking notes of some of your parts will, some of your health information will ask you whether in the family has a history of cardiovascular disease, hypertension, cancer, and whatnot. That is recorded or reported in the family history. Okay. Now, you got the history here. Okay. Now, another part, or I would say another major part of the patient's medical record would be the exam. Okay, exam. The exam is basically, guys, the physical exam. Okay. Now, the physical exam, guys, there are different ways doctors perform examination. Okay, so what are these different types of examination that the doctor perform? Okay, what are these? So doctors would do palpation. Okay, do auscultation. What else? The doctor will do inspection, percussion. So let's talk about this different types of exam that the doctor does. When a doctor does palpation, guys, this is the type of exam when the doctor uses his or her actual hands to kind of like feel a part of the body that is being complained about, right? If you're saying that, or if you're coming into the doctor's clinic or ED complaining of abdominal pain, the doctor will do this. The doctor will do palpation, meaning trying to feel physically what are you, complaining about. If you have some kind of abdominal tenderness, like, if you have a distension or something that is tender, in your abdomen, I'm pretty sure you guys, if you guys have been to a doctor's office, you have seen doctors did that, right? So feeling or trying to palpate, trying to, have a good feel of that body part that you are complaining about. So that's what we call palpation. So in palpation, it involves abdomen, right? What else? Maybe your neck, right? The doctor will try to feel the side of your necks, right? The doctor does that. Feel the side of your necks and see if there are any enlargement of the lymph nodes, right? If there are some tenderness going on there. So the doctor does that, right? So what else are other body parts that are involved in palpation? The doctor will also try to feel side of the neck, your abdomen, right? Now, for auscultation, what are body parts that are involved here? When you say auscultation, guys, the doctor uses his or her stethoscope. Everybody knows what a stethoscope, right? Even if you're not clinical, everybody knows what a stethoscope. So the doctor uses a stethoscope to listen to that body part, okay? So what are those body parts that doctors listen to? Your chest, right? Doctor listens to your chest, your back. What else? Doctor listens to your neck. What else? The doctor listens to. Doctor listens to chest, back, neck,
Abdomen.
the abdomen. Yeah, sometimes doctor would try to listen to the abdomen too. Rarely though, but a doctor does that too, right? See if there are any like growling in your in your abdomen, right? Okay, so what is the doctor trying to establish here when he listens to your heart, your chest? The doctor is trying to listen to the heartbeat, right? If you have some heartbeat that skips or heartbeat that's slow, so the doctor does that, right? And by the way, on the palpation, the doctor also palpates your wrist, right? The doctor also palpates your wrist, right? Trying to feel if you have a regular beat of your pulse right there, right? So auscultation, doctor listens to your lung, right? Listens to your lung if there are some wheezing or hissing sound or there's some high pitch when you try to breathe. Doctor listens to that. And when the doctor put her stethoscope in your back, he listens. She listens also to the sound of your lung. If there are some labored type of breathing that you guys are complaining about, so doctor will see if there are any obstruction in the airway passage. That's why he needs or she needs to listen to your back or your chest. What about the neck? What is the doctor trying to establish here? When the doctor listens to your neck, he's listening to the flow of the blood that's going to your brain. So he's listening to your carotid arteries. We have carotid arteries here, major carotid arteries, the internal and the external carotid arteries, and it is important for the doctor to listen to the flow of the blood in your carotid artery. See if there are any slowing of the blood or any particular sound that the doctor may become suspicious that you may not be getting enough oxygen in your brain, which is very, very crucial, right? If an older patient comes in and complaining about memory loss or headache or some chronic migraine, so the doctor listens to those. He or she wants to establish whether you are getting enough blood flow in your brain. Okay, so auscultation, right? Did I write it correct? Auscultation. Okay. Now, what about, like I said, abdomen? Listens to your abdomen if there are some inconsistencies, some growling, or anything that is also abnormal sound that your abdomen is trying to create. Even sometimes if you don't, even if you don't use a stethoscope, you kind of like list, you kind of like hear your tummy, your abdomen sometimes, making that weird sound, right? So we're done with the auscultation. What about inspection? This is the part of examination, guys, that the doctor will literally use a pen light, not pin light, pen light, and see looks at your eyes, right? If if your conjunctiva, is that the right way to say it? The inside of your eye, if there are any discoloration or any yellowing color that is going on in your eye, the doctor will most likely be able to tell you you might be experiencing some type of disorder. Okay, so the doctor looks at your eye. That is inspection. The doctor looks at your throat, right? If there are some inflammation in your tonsils and your lymph nodes, or if you're someone who snores like myself a lot in the evening, the doctor looks at the formation of your tonsils, if or the formation of how your tongue sits. Okay, because if your tongue is kind of like higher compared to the normal position of the tongue, that's probably the reason why you are a heavy snorer, right? So the doctor looks at those. So that is inspection. So inspection involves your mouth, right? Ears, Okay, what else? Eyes. And any oral cavity, right? Of course, your tongue. So that's are the areas that the doctor looks at during inspections. Inspection is the actual looking at the actual exam, looking at the uh, body part. Okay, and lastly, guys, I don't know if I still, if I am missing anything here, but the percussion is when the doctor now starts really doing an actual tap of the body part. Okay, when the doctor taps his or her finger on the top of your abdomen, if you are kind of like colic or feeling like gassy, the doctor would do that, right? Maybe there's some buildup or fluid buildup or buildup of air in your tummy that makes you colic, right? So palpation involves abdomen. Oh, percussion, I mean abdomen. What else? The doctor also tried to see if sometimes the doctor would tap your knee, right? Using an instrument, the doctor would tap the knee, right? It's a joint. The doctor would do that, right? If your reflexes are intact, right? So the doctor does that. So the doctor also sometimes tap on I don't know ankle. I'm not so sure, but what is prominent or what is usual is the doctor will tap the knee, so in order for to see if your reflexes are intact. So you got this physical exam, guys, and you have all these body parts the doctor look at, okay? And during the physical exam, the doctor also look at your appearance. It doesn't fall in any of these palpation, auscultation, inspection, percussion, but the ocular assessment of the patient's appearance, the doctor will have an idea of, what distress are you in the clinic for, right? If you're disheveled, if you are so, very thin or cachectic, doctor will have a good idea of what is he is expected to conduct the exam further, right? So appearance is also part of the examination. If you're heavyweight like myself, I'm like, kind of like overweight, struggling with my weight, all this the last 10 years, I guess. And that's important for the doctor, right? Okay, so you have the physical exam, you have history exam. Now, after the doctor has done all these guys, reporting or documenting what he or she finds out, now the doctor comes down to the assessment and plan, right? Assessment and plan. So, what does the assessment and plan contain? Okay, so after the doctor has already performed everything, guys, right? Interview the patient, has solicited all this information, like the doctor or whoever, the nurse who initially attended to the patient, asking the patient whether you exercise, right? You guys have encountered these questions. How many days you exercise or how many minutes you exercise? Sometimes I lie. I already know that. I already know that. It doesn't do me any good if I lied. But some say, okay, I exercise every day. But truth of the matter, who does that? Oh, there are people who exercise every day. I used to, guys. I used to run every day. I used to exercise every day. But age is catching up, and there are some like joint issues going on. We cannot do those things anymore when we were younger, right? Back in the day. But okay, so after all these examinations, all these interviews have already been done, have already completed, now the doctor comes down to his or her verdict. Okay? Now, part of the assessment, guys, the doctor will now make his own summary, right? So, what does the summary contain? What does the assessment contain? of course, the diagnosis, right? After the doctor has seen everything, right? The doctor now comes down with a diagnosis. Now, but before the doctor does that, in the assessment, that part of the medical record, guys, you will see, okay, you will see doctor will document or will report in the assessment and plan lab reports, right? Or lab results. What else? Imaging. Okay, imaging. What else? The doctor will also put any referral. Okay, if the doctor needs a little bit of conference with a fellow doctor, the doctor will report everything here. If the patient needs to be say assigned to the observation unit, if the patient is in the emergency department, the doctor will put here in the assessment and plan. But the assessment and plan, guys, the reason why we call it assessment, because the doctor had already made his assessment and came down with what we call diagnosis, right? Diagnosis. So what are the diagnoses? Of course, you guys already know. If a patient's hypertensive, having, complaining of headache, the doctor will now say, oh, you have a high blood pressure, okay? That's a reason why you feel like dizzy or you feel like your head is exploding. You have a very high blood pressure or you have a hypertension, really a severe hypertension. So the doctor puts that in the assessment, okay? So if you are diabetic, the doctor already saw in your history of present illness that you are diabetic. And in that, in that specific episode where your sugar level is too high, the doctor puts it in the assessment if you're having a diabetic hyperglycemia. So everything that the doctor decides, guys, okay, is in the assessment and plan. Okay? So everything that the doctor would want you to do as a patient, like you need to attend like smoking cessation program, or you need to at least attend one of those diabetic education session, things like those, right? If you are complaining of joint pains, the doctor recommends have a physical therapist to see you. So everything is done here in the assessment and plan. Okay. Now, the plan also includes, of course, not just the therapy, not just the medications. By the way, medications, when the doctor wanted you to, go to the pharmacy and get say, start on aspirin, start on statin or Lipitor or and whatnot. Everything here is in the assessment and plan.